a lot of the times parents attribute it to the stomach. And they say the baby's tummy is making a lot of noise, they're cringing themselves, and they're crying.
Welcome back to Ask the Experts here at Parents Magazine, where you ask your questions. You've been asking these questions on Instagram, on Facebook, on our page. And if you haven't asked your questions, go to those places and you will ask your questions. And we will bring in an expert to answer. The expert we have today is a pediatrician. So we're answering your questions about children, babies, whether you have babies or you're anticipating having babies, or you have a friend you can ask for, or you have a neighbor you can ask for, everything babies. So I'll let my guest introduce herself, partly because I've given up pronouncing her second name. Please.
My name is Dr. Rosemarie Gachie-Lopokoiyit, and I'm a consultant pediatrician practicing at the Hub in Karen, and my clinic is called the Pediatric Clinic Karen.
You've had that. Rosemary, if you can pronounce that second one. Karibu, we will be given a prize by someone. So on to your first question. You asked, should I use any medication for heat rash on my 4-week-old baby? So maybe you could begin by letting us know what heat rash is for those that don't know.
So commonly, heat rash occurs when a child is exposed to high temperatures, whether that means that it's from the environment or they've been overdressed, and it often happens in places that where the skin can't breathe. Okay, so basically what happens is that the sweat is trying to make its way out to the surface of the skin, but it gets blocked. So the kind of rashes that you can get really vary. For many of you who have had newborns, you might have noticed that you can see the child, and as you're watching, you see little blisters occurring on the forehead.
Yes.
So that's one type of heat rash, and it's just because the pores are not open, so the sweat accumulates just below the surface. Also, what can happen is that in a deeper layer of the skin, you can have the sweat because it's blocked from coming out, so it spreads into those deeper layers and causes a bit of inflammation. So typically you have a very small rash, small dots that are red, and that's what. And you often see them in places like on the neck because the skin layers, especially if the baby's a bit chubby, you might find them on the armpit
because there's a skin fold.
So the best way to avoid it, number one, if you're in a very hot place, you try and take the child to a cooler environment. Okay. Make sure that your children have breathable clothes, because even adults, actually, from the same principle, if you block the sweat from coming out, they can also get the heat rash. So you want to wear nice breathable clothes, okay? And those are the basic 2 things that you want to do.
What's breathable?
So like a nice cotton material. If you have like maybe a very polyester, for example, that doesn't let your skin breathe. You know how you can wear fabrics and you can feel like, man, I'm sweating. I can't feel like my body's getting enough ventilation. That's the kind of thing. So you want very nice, loose, breathable clothes. And generally for small babies, it's always good to let them wear cotton. Okay? Yeah, so using topical ointments usually is not necessary. Yeah. Once in a while, if it's very severe, maybe your doctor might prescribe a mild steroid. And that's the only time you probably use something topical. Now, with that said, often babies also have eczema. And there's a lot of confusion between the two.
Between eczema, heat rash, and even other rashes, right?
Exactly. So if you're finding a lot of rashes on the cheeks, often it's not likely to be a heat rash, because remember what I said, the sweat can't come out. It's blocked from coming out. So either on the skin folds or places where the clothing is tight, around the diaper, those kind of areas where you can get the heat rash.
Okay.
Yeah.
Is it possible for me as a mother to tell that at this extent I should seek medical attention with a heat rash? At what point do I need to go to hospital, and at what point do I just need to let the heat rash go away, probably just by changing the clothes or in the environment?
So generally, if the child is comfortable, okay, so often heat rash can be quite itchy, but in a smaller child, they might not exhibit too much discomfort. But if they are showing a lot of signs of irritation, like they're having poor sleep, they're always wiggling, because, you know, for small babies, they can't necessarily touch to scratch. But you might find them always wiggling like this, trying to scratch themselves. Or, you know, the baby just doesn't seem settled, it's a good time to go. Also, if you see the rash is getting worse, okay, Or you see that now, instead of the rash being red, maybe there's pus forming.
Oh, it's becoming whitish, yellowish.
Yeah, if it looks whitish, because you can still get super infection of those rashes. Okay? So that's a good time to go and see your doctor about it.
Wow. Thank you for that. We'll be going to your next question after this break, which will have something to do with crying of babies. So look out. So to your second and third question, I'm calling them second and third because I have a feeling they'll be related. The second question we're addressing is my 1-month-old seems very uneasy in her sleep. She twists her neck as though something is biting her. Is this normal? And then the third question is my 3-week-old baby cries too much. Is it colic? What can I do? Will you be able to combine all of that?
Yeah, sure.
Thank you.
We can. So the common thing that we see with babies is usually from around 3 weeks of age to 3 months is when many babies get this syndrome called colic. And I use that a bit lightly because a lot of the times parents attribute it to the stomach. And they say the baby's tummy is making a lot of noise, they're cringing themselves, and they're crying. So we don't have very clear explanations as to what exactly causes colic. But for sure there does seem to be some kind of disturbance with the intestines, number one. But there are other things that make it worse. So things like hyperstimulation. So when you get a baby, you have all these visitors. Of course, COVID has changed things. But what is the norm? You have a new baby, all the aunties want to come, and everybody wants to hold the baby.
The entire church.
And they often come in the evening, so baby being handed from person to person. So that's kind of like overstimulates the baby, and they can get very agitated. Okay, so having a very nice routine for the baby from birth, in terms of that, at this time in the evening we're going to wash the baby, and then they're going to settle down, and the house is nice and quiet, tends to avoid those colic episodes from being too bad. So what is characteristic about those episodes is that they occur frequently, usually around the same time, more often than not in the evening, where the baby can be crying continuously for hours. But the rest of the time they're totally fine. They are breastfeeding well, they're growing well, they're pooping well. So the baby doesn't seem well. Then all of a sudden you have this baby who's crying like there's something very wrong. But then after that, they're fine. So that's the typical example of a colicky baby. Okay? So having a good routine really helps to try and settle it. Okay? Various things have been given, probiotics, trying to get the bacteria in the gut back to normal, because of the kind of things that people think might be going wrong in a baby who has colic. But it's often just about giving the baby time. Okay? When you need to worry is when you see what we call danger signs. Okay? So the first thing, if you remember how it is to have a small baby, when they are born, they're very tight, isn't it? They don't want to stretch out.
They don't. In fact, they
always
have a problem washing them.
Yes, exactly, because they're always conjured. So if you ever find that your baby is floppy, that's a problem. Okay, so a floppy baby, very irritable. So when I say very irritable, that means they're crying, they won't settle outside those typical hours for the colic. Okay? Poor feeding. Poor feeding is never a good sign with a baby. So if you have a baby who does not want to breastfeed, they need to be checked. And then of course if they get fever, then you want the doctor to check out the baby. And with small babies, this is not something that you want to watch and wait. You know how you can have a 2-year-old who gets a bit of a cough, you said, let's watch and wait. For small babies, if you feel they are sick, get them seen. Because they can change condition very fast. Okay? Another thing that kind of causes some kind of overlap is something called reflux. Okay? So, the passage for milk or for food basically, from the back of the throat down to the stomach, there's somewhere that is supposed to have what we call a valve to stop food from coming back up.
It's like a muscle?
Fluids. It's like a muscle, yes, exactly. So there's a muscle at where the feeding tube joins the stomach. In small babies, it's not well developed, so it's very easy for for liquids to start going back up. Okay, and it causes reflux. So you can imagine something acidic coming from the stomach going back up. You know what heartburn feels like. Even as an adult, it feels uncomfortable. So sometimes babies tend to have reflux. Okay. In that case of the baby who you're saying has abnormal movements when they're sleeping, they're very restless. Sometimes it can be that they have this, what we call reflux. But with that said, there are so many different conditions in babies. And sometimes babies are just a bit fussy. Maybe they're not feeling so comfortable in the position that they're in, and that's why they're moving. But what I always advise my patients is that if you see something abnormal, take a video. Because if you send me the video, I can tell you, oh, this is that.
Oh.
Or this is that.
I've never had that idea.
It makes life so much simpler because, you have parents trying to say that when I do this, then my baby does this. And you can't really picture it in your head.
But we usually think you understand.
Yeah, but when you take a video, then it becomes so easy to know this is abnormal. Or this looks fine. Yeah, maybe the baby does that when they need to burp. Or maybe this baby is having reflux, because sometimes when the reflux is severe, it actually causes the baby to start arching backwards because of that acidity. Okay? So it's always good to discuss it with your medical provider, see a pediatrician. Just have a discussion about it. But if you take a video, it's always much more helpful.
Wow.
Yeah.
And I've picked something interesting about colic, because colic is all over the place. I mean, as in it's all over our minds and ears as mothers. And I'm gathering that maybe before we settle on its colic, we need to give the baby a proper routine. So that, it's not just the overstimulation that's making things bad for the baby and we think it's colic that needs medication. Yeah, so giving the baby a proper routine and then just observing, making sure that the baby is completely well at other times. For a first-time mother, seeing a child with colic can be very overwhelming because usually it happens at night. It goes on for hours. The mother is tired. They feel like something is wrong with the baby. It's often when they're trying to breastfeed, then the baby is so uncomfortable, doesn't want to latch. So you start asking yourself, is there something wrong with my breast milk? Yeah, exactly.
It's a very difficult, emotional time for a parent. So I always say that there's nothing wrong. Go see a doctor, especially at the beginning. If it's your second, third, fourth child, you have that experience. You know what? You're like, this looks like colic. I'm comfortable with the baby. Yeah. But for a first-time parent, it can be very overwhelming. Just get a checkup. And then your doctor will advise you on how to, things that you can do. Even they start promoting things like white noise. Like when a TV, you remember the old TVs before the channels were connecting? So they have some devices that make that background noise that helps to settle the child.
Really?
I've never used one. But these are some of the things that they talk about.
Oh.
That can be done, yeah.
Okay. So for this parent whose infant is wriggling in her sleep, they don't seem comfortable in her sleep. It could be colic, it could be reflux, like you said. From experience, it could be heat rash.
They're wiggling, trying to scratch themselves.
At some point, I realized my baby just wasn't being able to scratch, and they were and we went on for 1-2 weeks before we realized, it's the rash.
Yes.
So what else could it be?
So, I mean, you can talk about a whole list of things, but the problem is, like when you use Dr. Google and you see, it will tell you a lot of scary things. So sometimes it's better just let them be seen before causing unnecessary anxiety. You might start thinking of neurological things and it's really, like you said, it's the heat rash. So it's better for them to be checked.
Wow. Great. So we'll stop it at that for today with the babies, but we'll definitely have the expert again and continue to send in your questions so that we have something to tell you and we have an expert in the house to explain things really well. Thank you so much, Dr. Rosemarie, for coming along.
It's been a pleasure.
It's been a pleasure too.
Thank you.